My name is Dr. Sezen Altug with Bay Area Gastroenterology. I'm going to talk about chronic proton pump inhibitor therapy and the possible long-term risk of using them. Gastroesophageal reflux disease is one of the most common issues that gastroenterologists deal with on a daily basis. Approximately 60% of the population may experience some reflux during a year's period. 20% will have reflux on a weekly basis. It's in these people who have chronic reflux at least twice weekly that are at risk for an increased risk of complications related to reflux. These complications include esophagitis, or an inflammation of the esophagus, strictures, or a narrowing or scar tissue of the esophagus, which can lead to difficulty in swallowing, Barrett's esophagus, which is a precancerous condition, and even extraesophageal manifestations, such as chronic cough, asthma, laryngitis, and sinusitis. It's in these patients that the treatment with proton pump therapy is beneficial. There are many proton pump inhibitors available. They are branded under the names of Prilosec, Prevacid, Acifex, Protonix, Nexium, Zegerid, and Dexilant. Proton pump inhibitors work by blocking the hydrogen-potassium ATPase, or the proton pump, which is in the gastric parietal cell. It is responsible for the gastric acid secretion into the stomach. Proton pump inhibitors are more effective than another class of acid reducers called H2 blockers. Some of these are known as Zantac, Tagamet, and Pepcid. In the last several years, there have been many reports that have come out regarding the possible long-term side effects with using chronic proton pump inhibitors. The one that has been spoken about the longest is the risk of bone loss and osteoporosis. It has been found that there is a malabsorption of calcium and magnesium, both of which are needed in order to maintain strong bones. The mechanism of action, it is felt, is that calcium absorption does require an acidic environment in order to be absorbed. Despite these findings, the American College of Gastroenterology has not had any clear-cut recommendations for obtaining bone density studies in screening for patients who are on chronic therapy. They have also not given any definitive recommendations for calcium replacement. In my own practice, I do actually have patients take calcium supplementation and vitamin D supplementation when they are on proton pump inhibitor therapy, as long as there's not a reason not to do this. Proton pump inhibitors have also been linked to an increased risk of certain infections. It is felt that the acid in the stomach is a natural defense against bacteria entering. One of the infections that have been associated with chronic proton pump inhibitor therapy is C. difficile infection. This is a bacterial infection that can lead to a colitis or inflammation of the colon. There is enough evidence to suggest that people who are at risk for C. difficile infection, such as those taking antibiotic therapy or those who are in a hospital or in nursing home arrangements, should probably avoid, if at all possible, proton pump inhibitors. Another infection called community-acquired pneumonia has also been associated with proton pump inhibitors. Interestingly, however, it is not with the long-term use of proton pump inhibitors, but the short-term use, which has been found to have an increased risk. More recently, there has been linkage between proton pump inhibitors and chronic kidney disease. One study has shown that a 10-year risk of 15.6% for people who are using proton pump inhibitors compared to 13.9% for those who do not. Other diseases such as chronic liver disease, cardiac issues, and even dementia have been linked to the use of proton pump inhibitors long-term. So what are the problems with these studies? Many of these studies were small studies. Also, many of the other contributing factors to several of these diseases were not controlled. So although an association has been found between proton pump inhibitors and many of these conditions, a causal link has not been proven. So what are you to do if you do take a proton pump inhibitor and have chronic reflux? The consensus is that if you need it, you should take it. Patients who have regular reflux and who have any of the complications of reflux, as mentioned earlier, should be on a proton pump inhibitor. The benefits of using a proton pump inhibitor probably outweigh the risk of having one of these complications. However, it's those patients who are very stable on proton pump inhibitors or those who may only have occasional heartburn that should probably be given a trial of an H2 blocker or even use lifestyle modifications and no medication at all in order to control their reflux. Lifestyle modifications can work very well. If one maintains a stable weight, elevates the head of the bed or uses a wedge pillow, avoids eating within about 4 hours of bedtime, avoids certain trigger foods such as fatty foods, greasy foods, caffeine, chocolate, alcohol, and use of tobacco. All of these things can be beneficial in preventing reflux. So if you have reflux and are on a chronic proton pump inhibitor, talk to your doctor and make an appointment with a gastroenterologist if needed.